what risk factors you might have. But you know, we're not going to do that. But anyway, so if somebody says to you, what's a 3-generation pedigree, that's what it is. The patient, their parents, and then the siblings off to the side, which just doesn't actually show. So we're not going to actually do that. I don't think as a registered nurse, you're going to be responsible for doing it. I think you need to know what it is, what the risk factors might present to a patient to want to do one of those, and who to refer them to. Because if you're not working in genetics, you just need to be aware, okay, and assess. You know, a lot of my test questions, so I think I write them this way, and this is what I'll always say, when I give you a piece of data, even if I'm just giving you a report on a patient, often what you need next is more data. You have more questions, more data. Could be in vital signs, could be in read the chart, could be in get a test, could be a physical assessment, but now you know I need more data. Of the nursing process, what group is that? What category of the nursing process is getting more data?
Assessment.
Assessment. Don't think assessment is not an intervention or action. If somebody told you that along the way, they're wrong. Assessment is absolutely action. Whether it be walking in and listening to their heart sounds, or going to the chart and looking for blood work, or interviewing the patient about their pain level, all that's assessment. It's all assessment, and sometimes you need more data. So always try to use the nursing process. And if a question is asking you, and you're like, gosh, I don't know, I might need more data, don't make up a story around the question. Go and look at the options, okay? Sometimes it won't be. Sometimes it'll be you have enough and you need to intervene. But you need to read the questions. And assessment, are there other words for assessment? Does it always have to say assess and then something to be in the assessment category? No. It could be auscultate, lung, heart, valve sounds. It could be read the chart, ask the patient, smell the slide, thinking from my women's health world. You know, you're getting more information from somewhere. It's all assessment though. Okay, so don't ever forget that. When you read test questions, start with your assessment, because until you have what you need to answer the question, you might be assessing. And again, don't make up stories. I've had people who say to me, but it says that she's walking around the block and she's pregnant. That sounds like a really big risk factor to me. I said, does it say in there she's bedridden? It just says she's pregnant and she's going to take a walk around the block. Which pregnant woman, I mean, you as nurses, you're going to work up until the day you deliver, and you're going to probably do a 12-hour shift. So walking around the block is not dangerous. So when I said this to one student, they said, well, what if the pavement is uneven and she trips and falls?
Maybe where that
Does it
person
say that? No, but I'm just thinking. I said, then stop thinking and read.
maybe where that person lives, the sidewalk is, you know.
Well, that's what I'm saying, but it didn't say that in the question.
When she gets chased
It
by
just
a
said
dog
she's
while
going
she's
for a walk
walking
around the block. So don't read in too much to them. Okay, so let's meander on to 13, where we have lots of meaty stuff. Okay, so here we are in MP3 OB, postpartum, and now we're in adaptations to pregnancy.
Oh, got it.
So chapter 13 is adaptations to pregnancy. We're going to learn about the physiologic and psychologic changes of pregnancy. We're going to learn how and what does GPTPAL and EDB or EDD and EDC, which are all the same thing, what do they mean? Talk about the discomforts of pregnancy, how do couples become parents, some cultural influences, and when do we educate. So the uterus, the changes in the body. If we haven't said so before, let's say now that pregnancy is a 40-week period of time. Okay? It's not 9 months, it's 10 lunar months. It's 40 weeks. From the first day of the last menstrual period to the due date is 40 weeks. And that's really important for you to understand. Okay? So first day of the last menstrual period to the due date is 40 weeks. I think it might be me.
Yeah, I've been hearing it
Oh, you have?
too.
Yeah,
Tell me these things.
I thought you put that there on purpose.
No,
I was like,
I was trying to get it to play earlier and it wouldn't play, so. There we go.
oh, thank you.
So in those 40 weeks, we divided up into 3 different sections, which are somewhat important because there are different things that happen during this part of pregnancy or that part, and there are things that might be a concern in this part but not in that part. So we divided up. Of course, 40 is not evenly divisible by 3. So we have the first trimester, the second trimester, and the third trimester. Does anybody know the weeks? What's the first trimester?
6 to 12.
From 0 to 12 weeks. That's right. From 0 to 12 weeks is your first trimester. The second trimester then is 13 weeks to the end of the 27th week. And the third trimester is 28 to 40. By the time you're in your third trimester of pregnancy, about 1/6 of all the blood of a pregnant woman is in their uterus. So that's fairly significant. And as we're going to find out in a moment, that amount of blood is greatly increased, okay, over what our normal circulating is. I won't ask you specifically weight and size of the uterus, but I think we can all imagine the normal size of a uterus is about the size of my fist, not Cornelius's fist, but mine. That's about the normal size. It's fairly small. And how big does it get? Well, it's big enough for 8 babies, if you ask that woman. So
Oh, Mom.
gets as big as it needs to get. And then by the miracle of God, Buddha, Mother Nature, Yahweh, it goes right back down to its normal size. And hopefully, you know, pretty quickly, immediately, down to at least this size. And then how long does it take after delivery to get back to this size? 6 weeks, presumably, yes. It should definitely be back by 6 weeks. The pattern of growth. The uterus grows and we measure it, and we can really begin measuring it once it pops out of the pelvis. Our uterus is a pelvic organ. It shares space with ovaries and a bladder and part of our bowel, okay? But it's a pelvic organ. However, in the second trimester, so beginning about week 13, it goes pop and pops out of the pelvis into the abdomen. Now it's an abdominal organ. And then it grows week by week. By the time a woman is 20 weeks pregnant, her top of her fundus or her uterus, when she's lying flat, should be at the level of the umbilicus. Okay? So at 12 weeks, it's still in the pelvis, but at 13, it pops out. That's real significant because I said the uterus is in the pelvis. It's sharing space with the bladder in particular. So what kind of symptom are they going to have? Newly pregnant women in the first trimester will be having urinary frequency. Now that's a sign of a urinary tract infection, right? How will we know if they have a bladder infection or they're just in their first trimester and it's normal? We can do a urinalysis. We can also ask them for some other symptoms. What other symptoms might they have if they have a UTI?
And nausea and vomiting.
What's that big burning on urination word?
Dysuria.
Yes, you may now use that routinely.
Dysuria.
I've read dysuria. D-Y-S-U-R-I-A. Okay, dysuria is burning with urination. Also, urgency, which means I have to go and have to go right now. Like I can't wait 15 minutes for break. It's like I have to get up and go now or I'm going to wet my pants. So urgency, frequency, and dysuria are 3 early signs of bladder infection. Later signs, as it becomes not only a bladder infection but ascends up the urinary tract, will be fever, and if it gets to your kidneys, then you'll have flank pain. You may even have hematuria. But early signs are dysuria, urgency, and frequency. So we have to differentiate between that. But in the first trimester, frequency of urination is very common. So once it pops out, then usually that goes away. When does that frequency of urination come back?
And the last time.
In the end of the third trimester, when now the baby is the fetus. Let's say something about that in a moment. When the fetus is no longer floating, but is now heading back down towards the pelvis. The presenting part, which 97% of the time will be the head, is heading back down the pelvis. Now the head of the fetus is pressing on the bladder, and now they're going to the bathroom all the time. Okay? Now, watch me when I say baby and fetus. Sometimes I say the wrong word. What is it when it's inside the uterus? It's a fetus. Okay? When it comes out, it's a baby. If I say the wrong thing, forgive me, and when you read a test question, make sure you know what it says. Are we talking fetus? Or, and when I write a test question, I don't usually make that mistake. But does it say, what are we doing for a fetus, or what are we doing for a newborn? Because what we do in the normal are not always the same, okay? So make sure you differentiate. And forgive me if I say it wrong. A lot of us just call it a baby. But for we professionals, we shouldn't really. But I mean, what are you going to say to your patient, you know, who's 36 weeks pregnant? Oh, how's your fetus doing? Nobody really says that. You know, seriously, is your fetus moving? Really, doctors don't even say that. They say, how's your baby? Everything okay with your baby? Is your baby moving around? So it's not like I don't know the right word. It's just that that's how we say it, okay? Women can have contractions during pregnancy that are not related to labor, and those are called Braxton Hicks. A couple of things make a Braxton Hicks, and not a real live labor contraction. Does anybody know what they are?
Not measurable.
Go ahead.
They don't get stronger.
That's right. They don't really change. Normal contractions start out mild, far apart, not lasting for very long, but boy, they get closer together and stronger and come more often, all the time, okay? But Braxton Hicks, they can be beautiful, and you can pick them up on a monitor, but they always look the same, no change. Mom's not changing at all, no distress, any increased distress. Plus, because they're not really working right, what are they not doing? This is the gold standard.
They're not open and.
That's right, they're not dilating and effacing of the cervix. So Braxton Hicks can be concerning, and if usually providers will say if you have Braxton Hicks that lasts for more than 5 minutes, you know, give us a call. It could be that you have an irritable uterus and you're dehydrated. It could be you have a bladder infection, which is very, very irritable, causes the uterus to be irritable. So it's reportable if they last a long time. Most of them last a few contractions or just a short period of time, and that's okay. But again, they have them, they feel them, they have them, they feel them, all the same, they never change. And they don't change the cervix. So Braxton Hicks, no change. Blood flow, I already mentioned everything I wanted you to know. Now here are some pictures of cervixes or cervici. Not that you're going to have to memorize them at all, but just so that you know, when you put the speculum in and we look at the end of the vagina, that's what we're looking at. Some of you women may have seen your cervix before. As a women's health nurse practitioner, most of us are a little more earthy crunchy than healthcare providers that have the shorter letters after their name. But we usually give a woman who wants it a mirror. You want to see what your cervix looks like? Some people are like, oh no, thank you. And then others are like, yeah, cool. So some of you might have seen your cervix. So this is a picture of a cervix that's probably never delivered a baby vaginally before. And this is just a teeny little opening. This is the opening that grows to 10 centimeters wide for a baby's head to come out. So if you imagine that, you can see where that might cause some pain, right? Contractions, pulling up on the uterus in all different ways and stretching. The baby's head pushing down will cause that teeny tiny little opening to open to 10 centimeters. This one, I don't know if you can really see it, but it's kind of like a straight line, almost like a smile. That cervix has been dilated before. Not that you need to know. And this is not a good picture. It's supposed to show you cervical mucus. So remember, we have a lot of mucus from the cervix during the pregnancy. Okay, it's a mucus secreting cell. It secretes a lot of mucus at the middle of your cycle before pregnancy and then during pregnancy. The concern is, when would a lot of cervical mucus be a concern? What would it look like? If it was blood tinged, what would you not want to see in cervical mucus, like coming out of a vagina?
Infectious.
How would you know if it might be infectious?
Smelly or green?
Green, yellow, cloudy, smelly, okay? Itching, burning, none of that's normal. So when a patient says, you know, I got a lot of mucus down there, what do you need to know? You need to know more stuff, right? So you need to ask them, well, what does it look like? What does it smell like? Do you have any burning? So a lot of mucus is okay, but not if it's got any of that nastiness to it. So the vagina will also have a lot of mucus. It's also a mucus secreting cell. The same thing goes for that. Oh, I'm stepping in front of that. And the vulva can get full. They can get very full by the end of pregnancy because of the engorgement of the blood vessels. The pressure of the fetus's head on the blood flow will make the vulva get quite large. And in fact, they can even get varicose veins in their vulva, which are not only unsightly, but painful. So we can see that. Now what happens to the ovary in pregnancy is, this is a picture of an ovary. Here are a whole bunch of different follicles. And really and truly, every month we begin to develop multiple follicles. Our brain comes down and sends the FSH, and multiple egg sites start to develop. Because we're born, well, by the time we're a 6-month fetus, we have all the egg follicles that we're ever going to have, okay? But they mature during this process. So eventually, one of them will become ripened and mature, and the egg, or the ovum, same thing, will burst out, okay? And then we have this little spot left behind where it came from, and notice that it's yellow, and the word luteum, I believe, is Greek for yellow or something. I know Greek. And so this is called a corpus luteum, this yellowness that's left behind. That's really, really important because it secretes progesterone until the placenta does. So where does the pregnancy get the progesterone to support it?
From the corpus.
From the corpus luteum until about 6 weeks, let's say, and I won't ask you that time frame, but until the placenta takes over making progesterone. So this is literally a cross-section of an ovary, and this is the corpus luteum here. Now some of you might have heard of this before. This doesn't necessarily mean you're pregnant, because if you don't get pregnant, this just goes away. Just gets all small and goes away, and that's all it is. But sometimes it fills up with fluid, and some women get a cyst, and they call it a corpus luteum cyst. It's just the corpus luteum from where you ovulated from. It filled up with fluid, and now it's a cyst, for whatever reason. There are a lot of different causes of that. But it's not terribly pathologic or abnormal, although sometimes it does need to be drained. Most times it'll go away on its own, but really painful. Now this might be 18 to 20 millimeters big. That's not very big, is it? But it can cause massive pain because God Buddha Allah said, all those other people, said, here's your ovary, and this is how much space you have in the pelvis. That's all you get. And when you get any bigger than that, even if it's just a little bleb of 18 to 20 millimeters, you're out of your territory. It means you're pushing on somebody else's territory. And when we're pushing on somebody else's territory in the middle of our body, what symptom are we getting? Pain. Same thing with tumors, whether they be malignant or benign. Tumors often are your first symptom because they cause pain or blockage, because now they've grown outside of where they're supposed to be, and now they're pushing on something, right? So they're causing pain. So real estate issue, run out of space. So that's what ovaries do. Otherwise, now the ovary for the rest of the pregnancy is what we call quiescent or quiet. It doesn't do anything. It just sits there. Leave the light off while I show you these pictures of breasts. So, questions? So breasts, do they change? Yes. Sometimes the first symptom a woman feels of being pregnant is that her breasts are so tender and so sensitive. I've had women say to me, I couldn't even put a bra, they come for their pregnancy test, or couldn't